that. And I'm here to talk with you today about suicide prevention. So, to get started, I'd like to talk a little bit about what we need to know about suicide prevention. So, to start, suicide prevention is everyone's business. Okay. Most of us, family, friends, work colleagues, we're the first ones to notice a change in someone. And when we learn how to recognize some of the warning signs or clues, we can respond. And the quicker we recognize and respond, the better the outcome for the individual. Suicide is the most preventable kind of death, and almost any positive action can save a life. Okay. So, most people considering suicide communicate their intent sometime during the week of preceding their attempt. So, the more clues or warning signs we see, the greater the risk. Often people are struggling with that decision to live or die, and they're often struggling alone. They're keeping it to themselves. And when we notice a change by us asking the question can help lower their anxiety level, and it may allow them to open up and talk about to us about how they're feeling. So with proper treatment and support, most people may never feel suicidal again. So that's why, again, the earlier we connect to professional help, the better the outcome. So there can be many warning signs and clues regarding suicidal intention, and we're going to talk about some of the more common ones. It's not an all-inclusive list, but it's important for us all to know that any change in behavior warrants a conversation. We have to understand that sometimes warning signs may change based on culture. They can manifest differently for different people. So trust your gut, trust that instinct. If something doesn't feel right, we want to engage in a conversation and check it out. So now we're going to talk about some of those warning signs or clues. And I like the word clues because sometimes things aren't always as obvious, but there may be things someone is saying or hearing that may indicate to us that something's going on. So talking or writing about death or suicide. If we hear a direct verbal clue, things like, I wish I were dead, or I've decided to kill myself. And sometimes people can use oblique language or more indirect verbal clues. So things like, pretty soon you won't have to worry about me, or my family, would be better off without me. When we hear these kind of statements, we want to explore that a little bit more. So we might want to ask the person, can you tell me more about that? Or what did you mean when you said? And then repeat back to them their statement. Sleep disturbances. So this can be that someone is sleeping too much or someone is not getting enough sleep. They're having a hard time falling asleep or staying asleep. They can show signs of anxiety or agitation, and they might express feelings of hopelessness, despair, or feeling like there's no way out. If someone is looking for ways to kill themselves by seeking access to means, so things like stockpiling medication or trying to obtain a gun, for example, if they have a sudden interest or disinterest in religion, giving away prized possessions, so things that are important to them, or suddenly trying to get their affairs in order could be another warning sign. Death of a spouse, child, or someone close to them, especially if by suicide, that really is more of a risk factor. But, we know that these folks may be more vulnerable, so we may want to check in with them. If someone receives a diagnosis of a serious or terminal illness, or another warning sign is fear of being a burden to others. Previous attempt. Now, while I stated just a little while ago, again, most people, feel suicidal for only a brief period. We do know, again, this is a risk factor. If someone has attempted suicide previously, we know that they're capable of it. So we want to keep that on our radar as well. And a dramatic change in mood. And oftentimes when, we hear this, I think people all, we think they go from happy to sad. And that is certainly a good example, right? If someone's usually happy, jovial, and now we've seen a change, they're sullen, we would want to have that conversation. But conversely, if there is an elevated mood change. So again, if someone's baseline is they're usually very sullen or sad, and now all of a sudden we see an elevated mood, this could indicate a conversation. Remember what I said a few minutes ago, right? People are often struggling with that decision to live or die, and they're often struggling alone. Sometimes when they feel that they've made that decision, it may give them a sense of relief, and we might see that elevation in mood. So, all of these things, and again, remember what I said, trust your instincts, listen for any clues, and when in doubt, we want to have the conversation. So, how do we intervene? And, having the conversation can be difficult. And sometimes the closer we are to it, the more challenging it can be. So, I do advise right after we do all this and we go through all our points, practice with yourself. If you have someone to role play, to get more comfortable with having that conversation. We want to plan a private place. Privacy is a hot commodity these days. So remember, the halls have ears, right? So a truly private place for us to have that conversation with the person and to allow adequate time. This is nothing that we want to rush through. And when we approach, right, we don't need to jump right in with the suicide question, but we can start with approaching with I messages. And I messages as opposed to you. Try to avoid starting the sentence with you. You haven't been whatever lately, right? How about I have noticed, I am concerned, I am worried. And when we start with that, then we want to describe the behavior that we're seeing or hearing in the individual that has us concerned. Be specific. What are you seeing and hearing? We also want to speak in a confident, reassuring manner. So, what we want to do, even though we might be nervous, we want to project confidence because we want that other person to know that we care about them and we are okay having this conversation with them and that they can talk to us. Allow the person to talk freely. If they begin to talk, do not interrupt. Oftentimes, people, once they start talking to us, will give us a lot of the information that we need. And if not, we can certainly ask follow up questions when they're done speaking. We want to show empathy, right? So, trying to understand the world through their lens, try to understand how they're feeling from their point of view. And if we can, if nothing else, understand that they are in pain. Okay. Then, we're having the conversation. We need to ask the question. So, again, it can be challenging to ask this question, but the most direct approach is considered the best approach. We don't want to have any confusion on what we're asking. So, are you thinking about suicide? Or are you thinking about killing yourself? Either of these are totally appropriate. Now, I know sometimes people struggle with using the word suicide, so we could use a softer approach, still direct, but something along the lines like sometimes when people are feeling the way you're describing, they wish they would go to sleep and never wake up. I'm wondering if you're feeling that way too. So again, direct, but a little bit softer, whatever is most comfortable for you in that moment. I want to give a tip on how not to ask the question. So we don't want to use any leading questions. Things like you're not thinking about killing yourself, are you? Or you're not thinking about something stupid like suicide, are you? First of all, that is not demonstrating confidence. This is kind of sending a message that maybe we don't want to know the answer. So again, do your best to stick with as direct as possible. With all that said, how we ask the question is less important than that we ask it. Okay. Any attempt is better than no attempt. So, when someone is experiencing a suicidal crisis, our goal is to keep them alive in the moment. Okay. And connect them to professional help as soon as possible. We need to ask them, what can we do to keep you safe for now? Okay. We might think it's ABC when it's XYZ. So, we want to ask them, get their feedback. Then we want to offer referral resources. And I want to just kind of go over a few options. So, what we would consider the best option ideally is, we can offer to go with them. Can I go with you to get help? If they're not willing to do that, our second best option is, can we get a good faith commitment from the person to accept help and then plan to get that help? And then the third best referral option, if they're not willing to do either of those in the moment, is to provide them with referral resource information. And again, try to get that good faith commitment to not attempt suicide. And I always was follow up. We don't want to have one conversation and that's it. And follow up in any way that's comfortable for you. That could be a phone call, a text, a postcard. And ideally, if you know the person's preferred communication method, that would be perfect if we know, okay, they really prefer communicating via text, whatever that might look like. I do want to say also that we want to follow up even post crisis. So when someone has a suicidal crisis and they connect to treatment, so they start having treatment and maybe some of their signs and symptoms are starting to improve. One of the symptoms with depression is lack of motivation or lack of energy. So now maybe they've started treatment and now they have the energy, and that first 90 days is a transitional period. So now they might have that energy to put their plan into action. This is why post crisis treatment is so important. So, depending on our role and to the best of our ability, we want to support that person with following their treatment plan and following any post crisis treatment that's available to them at that time. And we are going to talk a bit about resources here in just a second. And I'm going to turn this over to our service chief of adult crisis stabilization and adult day hospital here at Shepherd Pratt, Dr. Jason Addison.
Thank you, Julie, for all that great information. And thank you, everyone, for spending some time with us today to think about strategies for suicide prevention and to highlight Suicide Prevention Month. So I couldn't agree more, Julie, with the very important points you made. And as a clinician, something that really stands out to me is that um, it really is an act of courage for someone to speak up and to tell someone, I am not doing okay. I might be having thoughts of hurting myself. I might be having thoughts of ending my life. And so, a lot of times these are thoughts that somebody may have had quite suddenly. Sometimes these are thoughts that someone may have been carrying for years. But we know that once we have this information, once we have this concern, it's so very important to then do something about it, like you said. And what we really want to do is create an environment in which people feel able to safely access care in a way that is supportive, in a way that addresses their needs in their moment. So I'm happy to highlight a couple of things that we have available here at Shepherd Pratt, in addition to in the larger community. So one primary way that we have of addressing acute concerns for someone who is struggling with self-harm or suicidal thinking is our psychiatric urgent care clinic. And what this is a outpatient clinic. It's walk-in. Appointments are not required, and patients can come on their own. They can come with a family member or supportive friend. And as part of this urgent care clinic, they would be evaluated by a clinician and assessed in terms of their needs and how we can best treat them. And that can take a couple of different forms. One form might be, provided that the person is feeling safe, in their home, would be to help establish care with an outpatient provider. So this could be with a psychiatrist, with a therapist, and to try to identify an appointment in a very prompt manner for them. So that's something that we can look at doing through the walk-in clinic. Another option, though, is getting some services here at Shepherd Pratt, including our day programs. And this is a program that I've worked in for years and currently run one of the adult programs. And I just think it's a fantastic way for people to safely and quickly get a prompt evaluation and to get the treatment that they deserve. So because this is maybe not as known in the community, I just wanted to kind of talk a little bit about the day program and what that entails. So it is a program in which it runs 5 days a week. And when you start the day program, you have an evaluation with a psychiatrist or a psychiatric nurse practitioner to fully identify any diagnostic needs and concerns, and then to come up with a treatment plan. And that treatment plan may include medications. It may include group therapy, and that's something that happens in the day program. So there are groups that focus on coping skills, cognitive behavioral therapy techniques, other forms of psychotherapy. But the idea is that someone is able to, be at home, but still getting a very high level of care. So that, again, it runs 5 days a week, approximately 6 hours a day. And so in addition to having a psychiatrist and a psychiatric nurse practitioner, they're also connected with a social worker and a mental health specialist. So they really have a team that's right there, going from the point of crisis to the point of treatment, usually hopefully within a day or two. So it's just really something that I like to highlight, because again, I do think it's sometimes just the knowledge is not there in our communities and amongst our friends and family. So the term you'll hear is a day program. You may hear this in other settings. It's called a partial hospitalization program, but it is, again, a excellent means of accessing care, and it's available for both child and adolescents. And then there's also a separate program for adults. And so as we think about this continuum of care going from a crisis assessment to perhaps outpatient treatment or perhaps a day program, there's always also the role for inpatient hospitalization for people who need a higher level of support, or who need additional treatment for their medical needs and their psychiatric needs. And those are available here at Shepherd Pratt and, of course, elsewhere in our community. In addition to the psychiatric urgent care that I mentioned, of course, these services can also be available through an emergency room. Also, if somebody has a pre-existing relationship with a psychiatrist or therapist, they can be referred directly to our day programs or to some of our other services. So that's another way to access treatment, would be to have your doctor, which could be actually your primary care doctor, could be a psychiatrist, therapist, to refer directly here to services at Shepherd Pratt for a higher level of care. And then also something that we also want to bring awareness to this month is the 988 program, which is the crisis hotline in which trained professionals can be available to address people during their time of need. So help is out there. And this is why I think it's so important that we're here today to talk about these resources that are there. And of course, everything that Julie said about identifying the need for treatment. And when you have concerns, to speak up, whether that's for yourself, your friends, your family, your loved ones. But again, help is out there. And I just sincerely appreciate everyone's time to think about the very important